Concussions have become a very serious and common injury among professional and amateur athletes who take part in contact sports such as football and soccer. The Mayo Clinic defines a concussion as a traumatic brain injury that alters the way your brain functions. Effects are usually temporary but can include headaches and problems with concentration, memory, balance, and coordination. Football, with a concussion risk of 75%, has become the most common sport in which a male athlete can receive a concussion, while soccer has become the most common sport for females with a 50% risk of concussion. In the last 10 years alone, the American Academy of Pediatrics has reported that emergency room visits for concussions in kids ages 8 to 13 years old has doubled, and concussions have risen 200% among teens aged 14 to 19 in the last decade. The most significant increase in number of concussions proves why there needs to be protocols and regulations put in place in order to keep an athlete safe. These types of injuries, if continued, can be detrimental to an athlete's body and mind. In order to protect the minds and bodies of athletes, the protocols and equipment need to be improved throughout all levels of sports to prevent and protect athletes. In doing so, concussions can be reduced and sports can be played in a safer environment. Concussions occur when there is a significant hit to the head and often result in nausea, difficulty concentrating, loss of balance, headaches, amnesia, and other symptoms. Continuous head impacts, however, can cause permanent long-term brain damage. Cumulative sport concussions are shown to increase the likelihood of catastrophic head injury, leading to permanent neurological disability by 39%. In order to prevent injuries that are catastrophic, the equipment used in games and practices need to be improved. Currently, football helmets provide a certain level of protection from serious head injuries, but there is not one that is concussion specific. The NOCSAE, the National Operating Committee on Standards for Athletic Equipment, state, "No helmet can prevent all concussions, even those certified to the NOCSAE standard." Currently, there are no helmet standards in existence that are concussion specific. Even though the helmets used in the NFL and high school football programs provide a certain level of protection, the regulations need to be improved in order to specifically protect against concussions. It is estimated that a professional football player will receive 900 to 1,500 blows to the head in a single season. If a professional football player receives 900 to 1,500 blows to the head every season, their equipment needs to be able to provide long-term support for an athlete. In addition, concussion protocol needs to improve in order to protect athletes before and after they receive a serious head injury. In the NFL, guidelines endorsed by the NFL Players Association from the American Academy of Neurology find that athletes are at the greatest risk for repeat injury in the first 10 days post-concussion. These guidelines, however, are not always followed. Data from the NFL found that half of the time, players return from concussions to play without missing a game. If this is the case, these athletes are not getting the designated resting period needed in order to recover from the head injury they received. Because they are not following the proper guidelines, these players will increase their chances of receiving another hit to the head that could cause long-term health issues. The regulations and protocols, along with equipment, need to be enhanced and followed in order to protect athletes from concussions. Sports science does an excellent job in describing the concussions in the NFL due to helmet-to-helmet collisions. Sports science does an excellent job in describing the concussions in the NFL due to helmet-to-helmet collisions.
Every year, over 100,000 concussions occur in all levels of football, and 60% of these are from head-to-head collisions. In an impact lasting just 15 milliseconds, a player's head, on average, experiences almost 100 Gs of force. And collisions on special teams can result in forces of up to 190 Gs. In the NFL, the average speed of a head-to-head impact, the velocity of both heads combined, is 20 miles per hour, with the struck player's head decelerating 14 miles per hour. According to studies done by Sports Science's chief medical advisor, Dr. Basil Aish, this 15 millisecond impact is equivalent to getting smashed in the head with a sledgehammer. In the last 10 years, the average number of days a concussed player is out has more than doubled, and even improved helmet technology is only able to reduce an 80 G impact to 40 Gs, still several times when an F-16 pilot experiences, and more than enough to cause a concussion or neck fracture. For Sports Science on ESPN, I'm John Brinkus.
Improved equipment and protocols would potentially decline the amount of concussions that are seen every year as well as keep players safe. With the current standards, 1 in 5 high school athletes will sustain a sports concussion during the season, while 47% of all reported sports concussions occur during high school football. In order to prevent these numbers from increasing, rules and regulations need to be followed thoroughly. If they are not followed, an athlete's mind and body can be impacted significantly. If an athlete were to receive multiple concussions, they would most likely experience lifelong effects, such as daily migraines, memory loss, and nausea. In addition, the damage caused by a traumatic brain injury affects the motor system as well as the patient's cognitive skills. The brain cannot turn back to its original state even after one concussion, let alone multiple. The brain may become more sensitive to any kind of impact, whether it's a simple bumping of heads or even playing loud music. One of the most recent findings regarding the long-term effects of concussions is CTE, or chronic traumatic encephalopathy. According to the Brain Injury Research Institute, CTE is a progressive degenerative disease which afflicts the brain of people who have suffered repeated concussions and traumatic brain injuries, such as athletes who take part in contact sports, members of the military, and others. The brain of those who suffer from CTE gradually deteriorates and will eventually lose mass, causing difficulty in controlling impulses or erratic behavior, impaired judgment, and gradual onset of dementia from the result of traumatic impacts to the head. The resulting injuries that can occur after an athlete sustains a concussion are immense. In order to prevent and protect athletes from receiving concussions, the protocols and equipment need to be enhanced and followed completely.